do in a Quad-Helix is to make it transversally passive, okay? This Quad-Helix is not passive, transversally, it's expanded. So first thing to do is remove the quad, and you can use your fingers to make it narrow, okay? Make like this, and make it transversally smaller. You can come here on top of the tubes a little bit more. You can hold here as well and make this. So now transversally the Quad-Helix is passive. Okay? Before you cut extenders, depending if you want to use the extenders or not, depending on the case, it's good to have the extenders to help you to raise or not raise this anterior portion here. Sometimes this anterior portion touches the patient palate and hurts. Okay? So holding the extenders with your fingers like this, okay, you can put this up or put it down, depending on the case. So in this particular patient, I want to put it up. Okay? So you can get back here to your patient. Now it's better in terms of adaptation. I will move the camera a little bit like this to show you that it's far from the palate now. Okay, good. Next step is to make it passive for the molars. So transversally is passive, the anterior bridge is passive. So now I need to insert one side only and make it passive for the left and to the right molars. When you have a patient in your office, in the beginning, I strongly recommend you that you tie a dental floss to this helicoid here, tie a dental floss here, make it long dental floss. If just by accident, if you are trying to adapt in this drop in the mouth of the patient, there's a risk for the patient swallow or breathe this Quad-Helix. So if you have the dental floss tied here, if this accident happens, you can, let's say, fish back, okay, fish back the Quad-Helix. So in the beginning it's good to have this extra care. So when I insert it to this molar tube, if I look to the other side, I have a little bit of a need of fix the rotation, you see? And also, what is going on here? Torque. Okay? So I need to put this down and a little bit forward in order to remove this activation. So I want to make it passive to the malocclusion. So remove here with the Weingart plier. So we need the Weingart plier, always helps you, okay? So hold here with the Weingart plier the two posts, okay? So we need to put this portion down, the opposite side down. So you can hold here and put a negative torque, and also move a little bit more mesial to fix rotation. So what I did, hold here, put it down, and move forward. Okay? Go back to your patient and check if this movement is already okay for him. It's basically yes, just one little bit more contraction, but let's leave the contraction to the end. Just now adjust the opposite side. So now insert the opposite side and check. I also need to remove rotation and a little bit of torque. So remove with the Quad-Helix the appliance. Okay. So hold here and you remove rotation. A little bit of torque, put it down. Rotation and contract. When you insert again to the molar tube, it's passive. Okay, 1 millimeter doesn't make any big difference. Okay, so it's passive, transverse, torque, and for rotation. So when you have the appliance fully passive, like this, you can cut the extenders the way you want. Usually, I cut the extenders close to the canine, and you can just make a mark here, close to the canine. If you want to move canines, you can. If you want to move bicuspids only, you can make it shorter. So where you're going to cut here is up to you. You can also use the extensions to place incisors forward. Okay? So many options to work with the extenders. You can cut it here. Okay, let me remove. I usually do this with the extenders. Grab the wing guard and you turn this little edge here to not hurt the tongue. A little bit in like this. Okay? So now the Quad-Helix is ready to activate because now it's fully passive. To full fit inside with the wing guard, you just squeeze like this on the distal post, okay? Not on the meso. If you try to squeeze on the meso, you cannot go down because the meso post is longer. So when I full fit inside, is it clear that the meso post is longer? Okay? So always you need to come from the distal. And you can do the same thing on the other side. So go here and squeeze on distal. Like this. Okay? And once you finish with the wing guard, you can also adjust intraorally in the mouth these extenders the way you want. Like this, put it in, out, okay? Great. My molar band is releasing. So now the Quad-Helix is full fit in. Sometimes this distal helicoid is too off and can hurt the tongue. What could you do at this moment? So you can come from the patient, ask the patient to open wide, and from the back you can ask the patient, please open. And you come with your fingers and make one squeeze down like this. This is it. Okay, so put your fingers on the helicoids, on the loops, and put it down. Now it's very good adapted. Just one push, but you must be sure that both sides are full in. Otherwise you distort the whole thing. Okay? So now the Quad-Helix is ready to activate. To remove the Quad-Helix, I will need a scaler. So with a good scaler, you can just come here, and it's visible that you have a little hole here, and you put the scaler inside and make like lever movements till you remove. Okay? And you make the same movement to the other side. Come here and remove. Once you remove, you can activate. So I have the Quad-Helix here, ready to be activated. Do you remember what is the first activation you usually do? So rotation. Okay? So rotation, you can use the Vanguard, holding here and making this, okay? Or you can do it with your fingers as well, like this. Okay? Come back to your patient, insert one side only, and see the amount of pressure you place to rotate this molar. You will see the posts going distal to the opposite side. This amount of distal movement you see here is enough to rotate this molar. Do not activate much more than this. If you activate more than this helicoid is going to be something like this. This is too heavy. If we need more rotation, just do gently, little by little. So this is activation for rotation. If you insert here, this side will rotate. Okay? So you can do rotation both sides simultaneously. No problem. Another movement that we can activate. In the mouth you cannot remove like this, okay? You need a scale. Because those tubes are already super used, okay? Another activation you can do is the expansion. With your fingers, you enlarge. Get back to the patient, insert, and you see where the posts are resting. If it's on top of palatal cuspids, you will have around 250 grams, which is very enough for expansion. If you want to open the suture, I need to have around 470 something grams, so you need to go up here, close to the buccal tube. Okay? When you make this activation, be careful, because the problem of Quad-Helix, especially if you do not control this very well, is the molars tends to go the crown and the root stays. So when you make activation for heavy forces, you need to control the torque negatively. You need to put a counter torque, otherwise you cannot control the crown and the root movement. So how can I put torque? So hold with the Vanguard the posts together, hold with your fingers the anterior bridge very strongly, and you make a negative torque like this. Okay? You put the roots towards to the cortical plate, buccal cortical plate. When you insert here, this side gotta go up, okay? It means it is inserted negative torque. So during the expansion procedure, this root will be torqued this way, okay? And tends to make bodily movement of the molar expansion. It prepares better anchorage. So don't put torque if you don't have heavy forces. If you have low forces, usually you don't need torque. Let's say if you activate for 250 grams, if you expand and you have something like this, 2-3 millimeters, easy enough, we don't need torque. Okay, it's just weight. Good, so now you can insert to the patient's mouth and say, are you okay? Everything good? Goodbye, go home. See you next time. I usually ask the patient to be back to my office every 30 to 40 days. Okay, in the first insertion, I ask the patient after 1 week, just to see if it's nothing, hurting, pinching, ulcerating, and so on. If it's okay, I will say to patients every 30 to 40 days. It doesn't make sense if you see the patient earlier, because the biological rebound takes about 30 to 40 days, depending on the patient's physiology. So if you keep activating every week, the teeth cannot move. Doesn't make sense. Okay? So, okay. Now the patient got back here after 40 days. What should I do? What should I do? Remove one side only. And check. If it's still active like this, just do nothing. Okay? Two options. Put it back and say goodbye, or decrease the force a little bit, because maybe it's too heavy and it's not moving. Okay? So decrease and put it back and say to the patient, get out of here, see you in 40 days. If you remove and it's passive, like this, now you can activate again and keep going till you reach the movement and the expansion that you desire. Okay? There's just one thing on Quad-Helix that is hard, is when this distal helicoid is touching the gingiva in this area here. This is the only hard thing on Quad-Helix. If this helicoid touches the gingiva, you need to remove this ischemia, otherwise next visit it will be covered by soft tissue. So how should we do it? Imagine this side here is touching and causing ischemia. The band is removing. So remove the quad. So to make this helicoid get out of this impinging or not touch the patient, distal to the molar, hold here the helicoid, hold here the posts, hold here this helicoid with your fingers, and place a heavy negative torque. Heavy. Okay? Make it a heavy negative torque. When you insert here, what are you going to see? The helicoid will be really off. Okay? But I don't want this torque here. How can I remove? Now, there's a little trick here that I discover sweating a lot in my office. Okay? Hold the helicoid now with your wing guard, like this, and put this whole thing down from the helicoid and do not work on the posts. So when you put it down, what do you see? One helicoid is 90 degrees to the band, another one is inclined. Okay, so it's completely out from the gingiva. When you make this activation, you distort everything, so you need to, adjust the Quad-Helix again and make it passive. But look at the difference now you have. One side is up, another one is down. Let me insert, you can see better. Is it visible? So this is the way we remove the helicoid when it's touching the gingiva in this area. So that's Quad-Helix and all movements that we can do. First step, make it passive to the malocclusion. Second step, adapt better as best as possible to not, hurt the patient. Third step, activate a little bit for the first activation. Every 40 days, you ask the patient to get back, remove one side only. When you remove one side only, you check passivity. If it's still active, do not activate again. Wait a little bit more. If it's passive, you activate again and let the patient's teeth move until you reach the movement that you desire. Okay? This is it.